Well, welcome everybody to this second attempt at a webinar. There's currently 5 of us here, including me, 11 people registered, so there might be a few more pop in over the next few minutes. If anybody can't hear me, could they please stick their hand up now, please? Although I'll put that out on a chat as well. It looks like everybody can hear. Bridget Hamilton has just bravely joined us. I don't know what time it is in Melbourne at the moment, but Bridget is still up and she's here. So that makes 5 of us, 6 of us all together. We're going to talk about soft words today. I've got a little presentation. We'll perhaps pause at the end of each slide and we'll see what everybody who's here has to contribute. So off we go. Just a reminder of what soft words is. We have a set of about 40... No, it's not supposed to do that. We have a set of about 40 statements which are hung up and displayed on the ward and changed periodically, and they give advice on how to deal with flashpoint situations, particularly those occasions on which we have to say no to patients, or when we have to ask patients to stop doing something that they want to keep on doing, or when we have to require patients to do something that they don't want to do. There is also in the 40-odd soft word statements some advice on particular attitudes to take and moral positions to take when engaging in these types of interactions. So there's 40 different statements which are prepared for you. You can download them from the website and print them out. They've got different borders and different fonts to give them some variety, and you'll see from the photographs here that some wards have quite artistically drawn frames for them to make them different as well. And then there's 3 separate postcards as well that reinforce the lessons from the soft word statements, and we'll talk about the postcards separately in a little bit. So that's what soft words is, and the aim here is to expand the skills and the tactical choices of staff in those known flashpoint situations. So what we want to do is give staff a greater range of choices to make when they're faced with dealing with these sorts of issues, so they can pick exactly the right one for themselves that they can make real and for the individual patient and the individual situation. It's also to generate the use of these types of interactions between the staff themselves, particularly in the staff hierarchy, so of senior staff to junior staff. So the same things that we're doing with staff to patients we should be doing with each other. But it's also about providing clear and powerful examples to the patients on how to treat with each other and with people in the community. So the idea is that we equip our patients with these skills so that when they're faced with challenging situations with each other, they can also help to calm each other down and to avoid conflict. Just a few notes on Fidelity. This is the same as the Fidelity message that was posted on Facebook recently. A little bit of expansion in there. So soft words is a set of situation-specific skills and attitudes, and it's about increasing those skills, the staff's options, and their use of good interaction skills they have in those known flashpoint situations. And it's a means of reminding and prompting nurses to always use the best style of communication in those difficult situations. What it isn't is just a set of signs that nobody reads, and it's not a soft option. These things are not easy to do. And neither is soft words any woolly or sentimental motivational statement along the lines of a patient's strong poem or these internet memes that you see out with little pictures and a few short words on them. Those things often say very sensible things or very nice things, but they're not necessarily soft words. Soft words are advice on how to deal with those specific flashpoint situations. If we think about long-term implementation, and Bridget might recognise this slide because it's from the ones that I prepared for the workshop that I gave in Melbourne. If we're thinking about implementing safe soft words on a long-term basis, what we've got here is a limited number of advisory statements and short summary verses on the postcards, and once you've shared those with your staff several times, people are just not going to notice them when you put them up again. They won't reread them. They become kind of blind to them. If in a sudden burst of enthusiasm for safe words, as some words have done, you put them all up at once, or you put lots of them at once, or you allow them to accumulate, you never take one down, but you keep a lot up at the same time, you can burn out their use. Once again, people become blind to them very quickly and don't read them at all or see them. So one way of keeping this going is to take them away for a while before doing the intervention again in order to regain the attention. So you put all the soft word statements away for a month or 2 months or whatever, and then you redisplay them. Or you can reformat them. You can take the same text but reformat them in a different form. You can use different fonts, print them out on different coloured papers, print them out in a different size, or you could reformat them. And I'll suggest you all take a look at the German versions of the soft word statements, not because you'll be able to read them in German necessarily, but because they've done something really nice in the way that they've presented them, and that could certainly be borrowed by anybody else. Our last suggestion for a long-term implementation is that you challenge your team to write their own verses or compose their own soft word statements to recommend to each other. And I'm still toying with the idea of opening on Facebook and Twitter and elsewhere a kind of a competition to create a soft words Mark II that we can all use in a longer-term implementation. In case there's nothing in case there are things that I haven't thought about long-term implementation, I'll invite you to raise your hand now if you've got any suggestions or you've got any comments about long-term implementation of soft words. Okay, Sean, you've got the floor.
Hi. I think we're very much victim to lots of the sort of the bad things, the things that we're not supposed to do with soft words, to be absolutely honest. I mean, when we very first started it off, one of the staff members who was the champion came up with this lovely picture frame with patient strong type, you know, these memes things, full of lots and lots of those. It was absolutely gorgeous, but it wasn't what was wanted at all. What we then did was we sort of made lots of, because we don't have very much office wall space, we made lots of small versions of them, but what we tried to do then was to actually have lots of them up at the same time. And yes, we've got to the point where actually people are blind to them. You move them around, and sometimes if you're sitting there thinking and doing a care plan or something, and you'll have this sign, this one in front of you, and you'll see it and you read it and you think, yeah. But I think we've got to the stage now actually where we need to be thinking about different ways of making it more lively, more active really. People are very much using the phrases, and that, you know, you can see that people are thinking more in the soft words kind of way. But yes, we're guilty of lots of the sort of soft words isn't stuff really.
Any ideas on how to revive it or keep it going?
I think probably we're going to have to get a little bit artistic with them. Our signs are all very boring, but they're just sort of, we managed to put 4 on an A4 sheet, so they're that small. They're all sort of cut out in different shapes and stuff like this, but I think we're just going to have to sort of be a little bit more creative and a little bit more artistic in the way that we're doing them. There are some gorgeous ones up on the forum and on the Facebook site, and you think, yeah, we just need to steal some of those ideas really.
Okay, yeah. Well, that's what this is for, to share yes. Ideas with each other.
Yeah.
I'm going to mute you now for a minute, Sean, because Tara's got something to say. Tara, the floor is yours.
Hi there. Our later life ward here at Woodlands, they've been looking at soft words, and what's worked quite well for them is at the end of each handover, they'll change their soft words each day, and then as a team they'll read out their soft words as a bit of a reminder after handover, and so it will change each day. And I think as a team they found that to be quite a good way just to reinforce the message, get people thinking, and you know, sometimes it has caused them to have a bit of humour about it really, whilst reframing some of the approaches that could otherwise be taken.
Oh, that's a rather nice idea.
Yeah, and Lewis, who's with me now, our PMA training team, we're working with them to make safe wards as part of the training for control and restraint. And Lewis was just saying about displaying these within the training suite might be a good idea as well for people.
Okay, that's good too. Of course, talk down is the closest related intervention to soft words, really. They're very close. I'm going to mute you now and then carry on with the next slide. Let's see, where am I going? So yes, I was just, are there any adjustments needed for speciality areas? I might call back on you in a minute, Tara, about that. Well, I don't see that really for CAMS or forensic there's any need to adjust any of the soft word statements, but I wondered whether for older people we want to create an expanded version with greater relevancy. Any comments about soft words and speciality wards? Put your hand up now if you'd like to make a contribution. I was hoping you were going to say something, Tara. The floor's yours again.
Thank you. We haven't concentrated or focused so much on our later life ward where people have got a diagnosis of dementia, but as to whether or not there could be a more visually related prompt, I'm not sure how that would be done. That might be a way forward. But interestingly enough, on the later life ward, when we've discussed this intervention in our patient council, they have said that they feel, like you said at the beginning, it's just as relevant to them in terms of how they talk to each other and talk to staff. So they actually requested that the same is reflected on the ward for them. So within a central communal area, the sign has changed quite regularly for them. But they haven't suggested alternatives in terms of different versions at all.
Yeah, that's something that we probably need to think about. Okay, Rachel, am I right, Rachel, that you're on a learning disability ward, or have I got that wrong? I've opened your mic now so you can talk. Are you there, Rachel? Hello, Rachel? Well, if Rachel is there, she's ignoring me or her sound isn't working, so we'll leave that for now and carry on with the presentation. This is one of the problems that we get with soft words. This has been reported by a number of different people. Sian's mentioned this to me at one time, but this got mentioned during the trial as well from some of the wards, that soft words were seen by certain staff as patronizing. And I've been doing a little bit of thinking about this. And I think this is probably because some of the statements are basic and obvious. That's definitely the case. And therefore, when you come and present these to the ward, they can easily become a lightning conductor for any of the anger or frustration that's generated from the oppression that frontline staff feel from constant demands and requests for change and do this and do that. And sometimes the embedded denigration of inpatient staff, that they're always being subject to criticism. And they're always being castigated for doing this, that or the other wrong. Therefore, when somebody from outside, like a researcher or managers on an implementation team, come along with soft word statements that do seem basic and obvious and that they feel everybody knows, then that can act to kind of spark people's anger, and therefore the soft words are seen as patronizing. But I think there are some things we can do to address this issue. We can make some additional statements. We could perhaps print out some additional statements to intersperse with the soft words, or just have some specific things that we recommend to the soft words champion to say loudly and frequently. Things like soft words are more difficult and challenging than they look. Things like, no, we don't know it all already. A lot of these statements, as some of you will know, come from research where we interviewed 28 expert nurses. These were nurses who were voted as being expert communicators with acutely ill patients by their peers. And what we found when we interviewed them was that nobody knew them all. So nobody knew all of these techniques or all of these different ways of behaving. And if they couldn't come out with, even the experts couldn't come out with them in an interview, it's unlikely that anybody will be able to know all of them or come out with all of these different approaches amongst the people who are working on the ward. So most people have only one or two options, and they fall back on these all the time. I'm sure I would be the same. So even where our knowledge is good, we don't use them all the time, neither do we always make the right choice, so there's always capacity to think about these things more. And even if you do know them all, there are many occasions where you forget or you're too hard-pressed to easily bring them to mind and use them. So the soft word statements are about putting these things at the forefront of people's minds so they can easily make a good selection. And lastly, some of them are obvious to some of you, but nobody knows them all. The other thing I thought that it might be a good idea to do with soft words is to display the more complex statements first, so then they're less likely to immediately evoke the patronizing interpretation. So if you shuffle through the soft word statements and pick out the most difficult, the most unlikely ones for people to already know, then there's less chance that people will see them as patronizing and more chance that they might accept the more easy ones later on. And I'm now coming over to inviting you to see if you've got any experience that you'd like to feed back. So if anybody wants to speak now about this issue of soft words being seen as patronizing, stick your hand up now and I will give you the floor. Rachel is saying she's trying to talk but her microphone is not working. So she'll perhaps be able to join us later. We'll ask her to have another go in a bit. Anybody want to speak about difficulties with soft words? If it's not soft words seen as patronizing, has anybody experienced any other difficulties with soft words? Yeah, Jeff wants to talk. There you go, Jeff, the floor is yours.
Hi there. First, can you hear me?
Yeah, we can hear you well this time.
Oh, okay, good, yeah. I was just thinking that the patronizing thing is probably because people might read it as instruction, and I think we need to be saying that it's more of a guide. In the same way as, I was just thinking of a metaphor, in the same way as it's a bit like, speed, what the speed limit is on the motorway. Nobody says they're patronizing, but they're just there as a guide to point people in the right direction. So it's a bit like, they could only be seen as patronizing if they're actually telling you what to do, and they're not. We trust people that they do know what to do, but these are prompts, reminders, guides, and it is, as you say, because we don't always make the right choices, it's good to be reminded. So I think that kind of language might help with that. But then, for me, they're much more of a guideline.
How do you think we could make it more explicit that they're a guide rather than orders or instructions?
How can we make it more explicit? We could have it somewhere in the kind of, somewhere in the language. Maybe we could maybe look at some of the language of, or maybe put them up software suggestions for your practice, something like that.
If you're thinking about the notice on the ward, you've just got these blunt statements that are posted up and changed.
There might be some of them that kind of, the reaction people say that's patronizing. It could be in the language as people take it as a kind of, perhaps they're assuming, I'm just thinking of the ones, it's like they are a bit directive rather than, they're called soft words, but perhaps the statements themselves aren't that soft, some of them. So they're more kind of, do this when you do this, kind of, or maybe some of them come across like that. So I think you could soften the language up while keeping the content, in some of them. I'm
Okay.
trying to think of an example, but I can't off the top of my head.
Right. Well, we can review them with that in mind. I'm going to cut you off now because Sian has got her hand up. The floor is yours, Sian.
You know, I was just thinking, I'm wondering whether saying that soft words is patronizing actually is just like a defense, because soft words very much, it's about the culture, isn't it? It's about the culture of the way that you speak to patients. And people know when they're talking to patients in a way that's really not acceptable. And soft words very much explains very clearly sort of, this is actually how you should be talking to patients. And I think when staff who are talking inappropriately to patients and who know that sometimes this just escalates situations, when they've actually got this very simple looking intervention which actually just tells them very, very clearly, actually the way that you're speaking to patients isn't appropriate, this is more how you should be talking to patients, they're going to react in a defensive kind of way, and I'm wondering whether that's where the patronizing accusation comes from.
Yeah, that could be very much so that actually seeing these statements is making people uncomfortable because it's confronting them with how different their behaviour is from what they themselves would want it to be.
Yes.
I mean, if they didn't care about it, they wouldn't be uncomfortable, would they?
Yeah, absolutely.
So it's showing a gap between what they're actually doing and what their own personal ideals about what they should be doing are.
Yeah.
Well, certainly that could be one reason why people see it this way, or an additional reason why they see it this way.
Yeah.
Sorry, I had to cut you off there. Did you have anything else to say, Sian?
No, I didn't.
No.
Believe it or not.
Okay, I'll switch you off and we'll carry on with the presentation because nobody else has got their hands up. No? Okay. The postcards. This use was not worked out well in the trial. My idea when I created these was that we should hand these out periodically during the course of doing the intervention as reminders or reinforcers of what was already in the soft words. What I found was that my research assistants and people on the ward didn't really listen to me, and that they handed these out pretty quickly once the wards received them. I'm not entirely sure what is the best way of using these, or really have I had much feedback about how they've gone down on the wards that have used them. So I'm open to experience and suggestions here. Anybody want to speak about the soft words postcards? You can see there from the questions, by the way, that Bridget is suggesting that soft words is presented as ideas to consider. Soft words to consider as a title for the poster might work quite well. Anyway, back to the postcards. Anybody want to mention the postcards? Yeah, Jeff is going to talk about postcards. There you go, Jeff.
I just want to say, don't do it this way. I think is a very good postcard, and I think it's interesting because the whole software things is here's things that you can do which are positive, but I think don't do it this way. That's the big red dot in the middle. You know, folding my arms, looking down, wagging my finger, wearing a frown. That I think that's a very challenging kind of one. And personally, you know, I'm not a clinician anymore, but if I was on a ward, I'd make that the center of a teaching session. Because I think one of the things about that, when I did the presentation, I kind of highlighted was when I read that postcard, the one thing it made me think is, Jesus, I've done all this stuff. And it is about that mentalizing of seeing yourself in action. So I think the postcards for me are beyond soft words, and I thought they would really fit in very well for the champions to run teaching sessions, or just some kind of focus group conversation about, you know, how do we stop doing this, or how do we react as viewers if we see one of our colleagues doing some of that stuff? To go back to Sian's point, you know, it isn't about saying somebody's a bad nurse, but it is about helping people out of very toxic kind of communication patterns that actually lead on to conflict situations. So I think it's a shame the postcards weren't used more, because I think there's an awful lot of potential in them.
Yeah. Did you mentored the research assistants? Did any of them talk about the postcards at all? I don't remember. Not in any of our meetings did it come up. Did it come up in any of your meetings with them?
It did, yeah. I mean, one of the things we have to sort of say to the champions was, particularly they don't do it this way, is be very careful about when you distribute them. You know, we had somebody who was kind of seeing somebody having a bad shift and perhaps doing a few of the things and then sticking it in their inbox, and we were saying, no, please don't do that. You know, it's not a red card or a kind of a message that So, you know, they need a little bit more thinking for the champions, and perhaps we need to think about a little bit more guidance for the champions about their use, about the kind of optimizing their use.
You know, when I wrote that, I hadn't really thought about the red card analogy at all. Well, there you go. Anybody else want to talk about the Softwords postcard or got anything to offer? Anybody use them? Well, not well, with difficulty, without difficulty? Okay, it seems like there's nothing more to add, so we'll carry on the presentation. Some thoughts on enhancing soft words now. Now, some of these suggestions have come up already, but I thought the champion could select which soft word goes up based on their assessment of the ward atmosphere and the recent events and stuff which has gone on the ward. And that the champion could choose the frequency of change to suit what they think is necessary. In other words, you're encouraging the champion to have a little bit more judgment and discrimination in what they're doing in terms of fitting the soft word statements to what's going on at the time and the needs of the team. I thought they could be enhanced by starting critical discussion or by sharing examples of use, and that ties up very nicely with what's Tara's mentioned about presenting them and discussing them at handover when they get changed. I thought they could be used in clinical supervision if there were some good clinical supervision structures in place on the wards, or used during debriefing after adverse events. There was a couple of things there about asking ourselves, can I do this more, or asking others for honest feedback, but that might be about leaders in the team publicly inspecting or asking these questions in front of other people. So they might ask in front of their team, I'm not sure whether I do this all of the time, or I'm not entirely sure whether I do this with you when I'm asking you to do things, for example, in order to generate conversations or openness in the team in which everybody is considering their own behaviour. See, if the leader can consider their own behaviour openly with the team, that makes it easier for people lower down in the hierarchy to consider openly their own behaviour, because they've got a role model to follow. Any comments on enhancing soft words? Any ideas? No, nobody's putting their hands up, although Bridget is making a couple of question contributions. Let's have a look. Bridget, do you want to talk? Come and talk to us from Australia and tell us what's on your mind.
Hi everybody, good morning, or whatever it is for you, it's good morning for me. I sort of quite like this conversation about the issue of safe words being potentially patronising, because it was my initial response in reading not the majority of the posters, but just some of them. So there was that one in particular that's kind of one of the more obvious ones is about distraction, and you think about how commonly people employ distraction techniques all the time, you know, distracting people from undesirable behaviour and getting them to pay attention to something else that will take them quite away from it. But I think that one of the things, you know, apart from having maybe having some kind of header, as you said, about an idea to use to sort of soften the statements when they're a bit obvious, the other thing that struck me is that it's really important to be reminding people somehow visually or in the training that it's not about using these strategies when it's easy. You know, it's about using those strategies at the more high stakes situations. And I think some of your examples are really good about, you know, can I do this more, helps us to notice those occasions where, you know, communication is difficult regardless. So, yeah, so I think that when people feel like something is kind of too obvious, teaching grannies to suck eggs, that could be a little off-putting. But I also pick up, was it Sian was saying that, you know, we can all be defensive too about the fact that, well, actually we don't do this all the time in all situations, even the most expert people. So, there's something valuable in being reminded.
Okay, thank you very much, Bridget. I'm just going to go around everybody else who hasn't spoken yet and see whether there's anything that they'd like to add to the discussion. And I can see Kelly Anderson there. Hi, Kelly. Are you there? Do we have any sound from Kelly? No sound from Kelly Anderson. Let's try you again, Rachel. Are you doing any better with sound, Rachel? No, I can see I can't even uncheck your sound, Rachel, at this end. So that would explain why you two have been so quiet. That's because you can't speak, and so there's no point putting your hand up. You could ask questions, though. Rachel or Kelly, is there anything you want to ask as a question? Type it in the question window now before we finish. No, there's nothing new coming through. Okay, therefore I'm going to bring this session to a close. Oh, we have something from Kelly. How have others faced challenges with staff who don't want to engage in soft words? Any comments from anybody? There you go, Jeff.
I think we have to, somebody who said, oh, I don't want to engage with soft words, I think we have to remind people that they work in a community as part of a team, and that if we have somebody who is, for example, not using soft words, that if there is conflict, it might not be conflict that comes to them, it could be conflict that comes to somebody else in the team. And we have a responsibility to each other, we have responsibility to patients, and we have responsibility to our colleagues as well. So, to be part of a team and then say, but, I'm not willing to make the place safe is something that we obviously gently challenge, but we have to challenge it. If you wind somebody up and then bugger off from the end of your shift, it could be the student nurse, the HCA, it could be somebody else that gets the result of that wind up. And I think we can all be honest and say we've probably seen that, and we probably just need to draw that to people's attention a little bit.
Okay, is there anybody else who'd like to say anything or ask any questions? Kelly's clearly saying thank you there. Okay, if not, I'm going to say goodbye to everybody. Thank you very much for engaging in this webinar. I feel like we've done organisationally a little bit better than we did last time, and I've actually recorded the whole session, so I'll get that posted up to YouTube before I go home this evening. Thanks everybody for participating. Thanks especially to those of you who are in Australia who have got up at some, I don't know what hour it is where you are, but it's obviously something worse than it is here. We're about to go home from work, or at least I am. Sian has been working nights, so I think she's just got up for the day. 2:30 a.m. in Melbourne at the moment. So there you go. That's real dedication to duty. Thanks very much, everybody. And Jeff and I will set a date for the next webinar. And we'll put a call out via Twitter and Facebook to ask for people to nominate what intervention they'd like us to discuss next. Thanks very much and goodbye.